You are listening to Radio Cosmos.
All night long.
Bravo!
My compliments, little lady.
Commercial! Break for 30 seconds. Commercial!
You are now listening to BaaD Radio.
Hello and welcome as we launch into the second hour of BaaD Radio. I'm going to run through all of the regular stuff just for people that might have just joined us. We are BaaD Radio, and BaaD stands for Business at a Distance, which means we're a show about local businesses and business networking. I am your host, Angela Smerito, and I want to give a huge shout out to Anna Smerito with BaaD Marketing for the amazing job that she's been doing with the BaaD Radio YouTube videos. Converting these shows into short-form content reels has been a huge place of growth and value for our guests. And so just want to say thank you for that. Okay, so we have another brand new guest to the show today. Please join me in welcoming Dr. Shawn St, owner of Osteopathic Health of Orlando. I got that all out without having to take a breath in between. So
You did. Thanks so much for having me.
Osteopathic is a little bit of a mouthful. What exactly does that mean?
Yeah, so osteopathic medicine.
Gotta talk right into that mic for me there.
Osteopathic medicine it's actually surprising how few people understand or know what it is. It was created in the United States in the late 1800s.
Osteopathic was? Okay. All right.
Yep. And at that time, the country didn't really have any real medicine, and so the medical system wasn't very effective. And it was designed by a gentleman named A.T. Still, and he was actually a Civil War surgeon. And
Really?
He had lost.
I'm gonna keep on you. Pull that towards you so we can hear you. Okay, there you go.
Great. So he was a Civil War surgeon, and unfortunately, he lost his wife and his children to spinal meningitis, and so he was very upset with the current system. So he spent a lot of time working with Native Americans and people throughout the world, coming up with different ideas and how to promote health, and ultimately focused on healing the musculoskeletal system and promoting the body's ability to heal itself. And so that was very effective for him. Shortly afterward, chiropractics came out, kind of almost following what they were seeing him do. And then in the 1920s, after the Spanish flu epidemic, the whole country had basically modified the entire medical system. And at that point, all the osteopathic physicians that were mostly doing manual medicine and organic healing with their hands started learning all the regular medical, went through all the medical training. And so since the 1920s, they've been kind of standing right up with the MDs, but also offering all this ability to heal the body with our hands and get rid of restrictions that are limiting health and promoting health.
And nowadays people will call you witch doctors and all that other stuff if you're trying to do something that's not, supportive of the initiative. But first, before we get into all of that good stuff, let's talk a little bit about your background and what brought you to owning your own practice today. So start from, like I said, let's go back to where you're from.
Yeah, so I grew up in Western Massachusetts.
Okay.
I went to medical school in Maine at the University of New England.
What made you decide to go into medical?
To be honest, I had, when I was a teenager, I had to have a surgery, and it was a hernia operation. And being 13 years old and going through puberty and having to show yourself in front of all these people and doctors.
I'm so sorry. Bless your heart.
Yeah, it was really overwhelming. And the experience went well, but it really made me understand of how important compassion is in medicine and making people feel comfortable no matter what's going on. And so that was one of the main triggers for me to go into medicine.
Really?
Be somebody that people
So it's
felt
not like a
comfortable
family.
with.
I mean, your dad's not a doctor or anything.
No, I'm the first one in the family.
See, that's actually really uncommon. You know that? Because like I said, I talk to a lot of people that are in the health and wellness, and most of them are because it's a family, whether the dad's a chiropractor or something, you know what I mean? So that's really cool. So this started from a childhood experience. Okay, so you went through high school, you went to college, and then you I know there's different levels of doctorate. So I get a little bit confused because a chiropractor is a doctor, but not a medical doctor. Can you explain how that all works?
Yeah, so anyone who has a PhD can be titled with a doctor. It's different than being a medical doctor or an osteopathic physician. So in the U.S., there's 2 qualified physicians, 2 different degrees that would give you all the rights to practice medicine, do surgery, and everything like that. And those are MD, medical doctor, and then osteopathic doctor.
Okay. So, and the main difference between the two is just really like one's going to be, I'm not going to go there because I'm going to be like, one is going to be supporting writing a bunch of prescriptions. The other one is going to go in a more natural way. Is that more true?
Osteopathic physicians are physicians. We prescribe medications and do everything that everybody else does when indicated. But I think the focus is, we're trained to focus on finding the organic cause of everything.
Okay.
Getting to know our patients, having better bedside manner, putting all the pieces together and keep digging till we find the underlying cause. And so we still use medications for sure, but we're actively trying to find out what is causing all this. And sometimes that can be very difficult. So rather than somebody coming in with a symptom and getting a prescription to deal with that symptom, and then later on coming back with a symptom from that medication and getting other medication for that symptom.
That's the part that's crazy.
Yeah, and that happens with these rush visits that we see in the current medical system. So with osteopathic physicians, we're trained to look at the whole body, and we also learn a lot more anatomy and ways to heal the body with our hands, and that blends into what people would think of as massage, energy work, chiropractics, balancing the length and tone of muscles, rebalancing ligaments around joints. We have a huge focus on the development of the human being, so a lot of embryology in our training and a much more intense training with anatomy.
Really?
And so that allows us to take on really complicated cases where we need to heal things, and sometimes it involves adjusting the spine. Sometimes they're not able to adjust the spine. They're too sensitive or something's going on.
Right. Okay. Well, I mean, in your past getting up to where you are now, you did work in just regular medical field, right?
Sure, yeah. I trained in internal medicine, and I was gun-ho with critical care. So I loved being in the ICU and saving lives when people were
That's got to be feeling
death.
Amazing, but I can also imagine it takes a toll, too, because not everything has got a happy ending, right?
Yeah, I mean, it was pretty good. So I didn't have too many bad endings, but
well, that's good. I think one bad ending would derail me completely forever. Yeah. So,
I think ultimately I chose not to go into critical care and to pursue furthering my education in osteopathic healing and neuromuscular medicine, because after years of being in the ICU, you're seeing people in the last year of their life that are constantly dealing with the end of their disease, and you're helping them. But I think really what I wanted to focus on is, how do I prevent them from getting to that point? How do we find these answers for them earlier on in their life so that they don't have these major heart attacks and different complications that lead them to kind of a downward spiral of disease.
Right. So from the ICU, did you open your practice right after that, or how did this happen gradually? Yeah,
so I came down to Orlando from Massachusetts to do my fellowship in neuromuscular medicine. And after that fellowship, they invited me to...
Is that like an internship, a fellowship?
Yeah, it's like a specialty training. Like,
okay.
So after internal medicine, you could go into oncology or cardiology or any of those. I chose to go into neuromuscular medicine. And so I came down to Orlando, did a fellowship. That was wonderful, coming down to the sunshine from Massachusetts.
Right. Had you ever been to Florida before?
I had once.
Oh, okay.
And that's a whole story in itself, because it was raining and 30 degrees the whole time, and it was the one time our family came. But
oh, geez.
Very unique, yeah. So after I finished my fellowship, the program asked me if I would be a teaching physician and teach the new doctors that were just graduating how to take care of patients in the hospital and teach them more of the intense parts of medicine. So we would do that, and then we'd also heal people in the hospital that were suffering from pain or getting out of the ICU with a lot of problems, and we'd heal them naturally as well. But mostly my job for 7 years was teaching acute care medicine in the hospital, heart attacks, strokes, severe illness.
So you're teaching students how to treat or how to work with those patients.
Yeah, teaching doctors, actually. And we had students as well, but these are new doctors doing their training in family medicine.
Got you. All right. So that, like I said, I could ask you a million questions about how all of that works, but I'm watching the clock, and so we're going to be coming up to break real quick. So when we get back from break, what I would like to do is I would like to talk about the practice that you have now in Baldwin Park, right? And that I want to go over each of the types of treatments that you do throughout for that whole entire practice. So we still have 3 more segments. So I know there's a lot on that list, and we'll check them off one by one. Okay?
Sure.
Does that sound good?
Looking forward to it.
All right. So everybody stay tuned for more BaaD Radio, because we got it coming up next. Augers Grill and Bar. Looking for a place to go with friends or meet new ones? Then you're looking for Frogger's Grill and Bar. With daily specials, an amazing kids menu, and college and NFL football over 50 large TV screens. Plus, don't forget about Frogger's amazing menu where everything is fresh, never frozen. And with 4 great locations, there is bound to be one near you. Oviedo, Mount Dora, Apopka, and Altamont Springs. Frogger's. Hopping with food and fun. All right. So please join me in welcoming Dr. Shawn St, owner of Osteopathic Health in Orlando. So the first segment, we got to hear a little bit about your history, and I said when we get back, I really want to dive into your practice here. So let's just start with when you opened.
Yeah, sure.
And actually, I want to kind of find out what brought you to saying I just want to open my own practice.
Yeah, so I was, like I said, we were taking care of hospitalized patients in East Orlando, and I was just seeing a lot of people continuing to come into the hospital, and it didn't seem like they were getting very good primary care, and nobody was really picking up the ball or taking ownership, and a lot of people feeling like they're getting shuffled from doctor to doctor, specialist to specialist. And so I opened my clinic trying to basically prevent everyone from getting into the hospital, taking a more proactive approach. So.
You just triggered something because my mom, I noticed that she's old. My parents are in their late 70s, and my mom, lots of times she's just like, I just don't feel good. And she would go from specialist to specialist to specialist, and nobody has been able to really figure out why she doesn't feel good. It's like, let's try this. But I don't think she's tried an osteopathic doctor. I wonder what kind of a difference that would make.
Yeah, well, I think it depends on the osteopathic doctor, because there's a lot of osteopathic doctors or DOs that are doing regular medicine.
Mm-hmm.
There's far less than there used to be that are doing regular medicine and also doing traditional osteopathic medicine and healing. So that's something that we offer at Osteopathic Health. Going back to
your practice.
The practice, yeah. So when I first opened my practice, I would get a lot of people coming in with chronic pain or complicated pain issues that had already been through, surgery or different things like that. And I'd also get a lot of complex patients that were at the end of the road. They'd been to all these different specialists, and everyone had kind of said, it's not in my lane, go see this person.
Right.
And it wasn't in their lane. And what I found was that they were lacking somebody to take accountability and ownership of their patient and really devote themselves to figuring out what was going on, and also have the intellectual interest to look at the things that aren't just in the standard mainstream cookbook of medicine. So,
but why do you think that is? Is it because of insurance and everybody gets 12 minutes, or when did we lose the doctor cares?
Yeah. So, and to be honest, I think a lot of doctors start off with empathy and they just get burnt out with the system. So, unfortunately, right now, the medical system has become a business, and what you have is these huge healthcare systems battling insurance companies, and everything's getting regulated. And unfortunately, the doctors and the healthcare providers with nurses and everything, they're getting kind of squished. So they're becoming kind of, I guess, workers on an assembly line, and they're dictated by, you have this much time and you have to get these people out of the hospital in X amount of time. And there's so much pressure put on everybody that they're moving so fast that they have time to address the things that are straightforward. But anything that's kind of not straightforward or complicated, or it's going to take a lot of extra time, they tend to kind of not take that on and try to seek a specialist that will take care of it. And
right.
A lot of the problems might be something that is in a specialist category, but even the specialist is too busy to kind of figure it out, or they just don't have somebody looking at the whole body, all the systems, all the specialties at once to kind of put everything together. And so there's certain areas of medicine that have been, I would say, subpar in general.
Right.
Hormone therapy is one of them.
I'm a firm believer in hormone therapy. Is that's something that you believe in?
Yeah, absolutely. So, in my practice, I've tailored a lot of things to what my patients need. And so I kind of tailor my learning towards that too. So about 2 years ago, I started into more training with functional medicine, hormone replacement therapy, anti-aging, peptides, things like that, to help supplement the care that I can give through internal medicine and the healing I can do through physical healing through the osteopathic medicine. And that's been great.
Right. Well, I recently, over the last 2 years, I'm 51 now, but I went through menopause. I put on 40 pounds and I felt terrible pretty much all the time. My sleep was bad. I had hot flashes, and I just honestly, the weight gain was awful. So, and my good friend Emily Murphy, she has her own business called Elevate Health, and actually I'm going to introduce you to because you guys would be really good referral partners. She changed the thyroid medicine that I was on, that I had been on for 15 years, and I'm on estrogen and progesterone, and she did a couple other things because my doctor was looking at my blood work saying I was fine. I was within range.
Yeah, so unfortunately what happened with hormone therapy is, in the 90s, everyone was getting hormone therapy and women were feeling great and they had this answer to menopause, but they were using tablets that were made from horse urine estrogens.
Oh my God.
Yeah, and they were pills, so they had to go through the liver, and the liver was having a really hard time metabolizing those estrogens. And so, the Women's Health Initiative, there's this big study that came out right around 2000, and the study was made to show how amazing women are doing and all the health benefits of hormone replacement therapy. And they had to stop the trial early because they noticed that women were having more blood clots, strokes, heart attacks.
I heard the blood clot thing before.
Yeah, increased risk of breast cancer. And so from that point on, it became this big stigma. Don't give anyone hormones. And pretty much.
And that was in the 80s?
No, that was actually right around 2000.
Okay.
So for the last, 15, 20 years, nobody's really been prescribing hormones because of that study.
I talked to my primary care of it, doctor, and he told me about the blood clots. And he was very, very, don't do it.
Yeah.
And I went against his advice because he told me that getting old was not a disease, that it was natural.
Yeah,
so it was okay for me to feel like garbage. That's it. Just get used to it, basically.
Yeah, and unfortunately, since that came out, all the litigious, all the legal complications of prescribing hormones, everyone gets scared about it, and they stopped training. I mean, I didn't get trained in medical school to replace hormones. But if you really look at all the data and all the studies that have happened, there's been so much information and studies about using bioidentical hormones, and for estrogen, you need to actually use it topically.
That's what
so
I have, a
it
cream.
bypasses the liver. And so if you use bioidentical hormones and you use your estrogens topically, your progesterone can be oral, your testosterone can be injections or topical, then you actually don't find that there's any risk in any of these studies about increased risk of breast cancer or cardiovascular disease. And actually what you find is a 50% reduction for the most part in breast cancer, cardiovascular disease, cognitive decline. And what happens is, not only do we treat hot flashes for women that are, kind of going insane, but it helps not only with mood, but they're feeling themselves again.
Oh my God. So what happens, I got all balanced and everything's good. I lost 40 pounds. I sleep great. I feel better now than I did when I was like 45, 46. Like, I probably feel as good as I did when I was in my 30s.
Exactly. And so it helps with your relationships, your libido, and I think it really just helps promote your confidence and your sense of self-worth to yourself, and that's something that I think affects people when their hormones go down too. And besides all those, you're also, as you age, and that's something I think that we need to get over is, just saying you're getting old is no longer acceptable. You know what I'm saying?
According to my primary care, it's just a part of life.
It's an easy answer to not jump down a rabbit hole you don't understand if you don't have time and you don't understand as a physician. But, through functional medicine and a lot of the new approaches and through hormone replacement therapy, there's no reason why we can't keep people feeling 40 years old up until their 70s.
Right.
And why do we have to sacrifice that? There's safe ways to replace the hormones. And another thing that you have to do, that I do, is you need to monitor using special tests. So not only do I want to start you on the hormone therapy, and we're going to balance that out and go through how you're feeling and your symptoms to adjust the doses, but after you're on a pretty good dose, I'm going to look at
your labs, right?
Well, special labs. What are all the metabolites of your estrogen? How is your liver metabolizing those? You can look at these different pathways to see, is your liver processing these in a way where it's safe, or is the estrogens going down a bad pathway where we need to...
And you can tell that by looking at blood work?
Not blood work. It would be a specialty test, like the Dutch test, where we're looking at urine samples.
Oh, okay. So I was just trying to think of, do you have to go to a special, like a LabCorp or something like that to get it done?
It's actually some of these tests are not available and they're not covered by insurance, but they're very important.
Right. So it's a mail out kind of thing. But you can make it happen because you can order it or whatever.
It's not something you have to do all the time. It's maybe once or twice you would have to do it, but it really gives you the confidence that not only am I feeling good, but I know that I'm processing all these hormones correctly, and I'm not
going to make it worse for the future.
Exactly. So I want to do it in the right way, but I also want to make sure that everyone's safe as we do it. Yeah. And there's ways to do that.
No, that sounds fantastic. And we're going to keep talking about that when we get back from break. So everybody stay tuned for more BaaD Radio coming up. Welcome back, and this portion of the show is brought to you by Liberty Property Inspections. Your home is one of your most important investments, so don't trust it to just anyone. LibertyPropertyInspections.net, helping you protect your investment. So did you hear that there's another storm out there? Yes, I'm not kidding. So everybody, we're talking with Dr. Shawn St. Marie. I always want to know St. Mary.
St. Marie.
I like St. Mary, but St. Marie, okay. But yeah, there's another hurricane. I think its name's Sarah. I'm not 100% sure that's in the Gulf, or that there's another good chance that it's coming through next week.
We just got over the last two.
So welcome to Florida, sir. You know, this is what happens. In 2004, we had 3 hurricanes. Well, what year did you come down here?
I came down here in 2014.
Yeah.
I actually thought I was going to be here for 1 year and go back up north, and I've been here ever since. So.
That happens a lot.
Yeah, and I'll tell you, when I do leave and go back home or go on vacation, it actually feels good coming home here. So
yeah,
I think it's become home.
Right. I'm a native Floridian and born and raised. My family lived over in Germany for a couple of years, but other than that, I've been here my whole life. And I probably foresee a move towards the West at some point, when the kids are older. And it all depends on, I want to be close to them no matter what. So, the older I get, the less I like the heat.
I hear you.
So let's jump into your practice. So let's just tell me a little bit about your practice. Well, actually, tell me a lot about your practice.
Okay, great. Yeah. So Osteopathic Health of Orlando is an integrative medical practice. Mm-hmm. So I have a base of internal medicine, which is complex medical.
And you're located in Baldwin Park, right?
Yeah, we're in Baldwin Park.
Mm-hmm.
And so we also offer osteopathic healing, neuromuscular medicine. So a lot of people seek us out for pain, complicated pain that they might not feel comfortable going to a chiropractor because there's a nerve that's getting pinched and they're trying to avoid surgery. And so just to get a physician that's specialized in that.
You see that pain is like the biggest motivator for bringing people to you?
Pain's a huge motivator, and people will seek people out for that for sure. And so I've had a lot of success with the training that I've had, using my hands to fix a lot of things. And I also incorporate specific musculoskeletal injections to help out. So a lot of more orthopedic type injections, but also using newer modalities like platelet-rich plasma or peptides to recruit your immune system and your healing part of your body to come over to areas that are injured.
And some people will think that like the PRP and stuff like that is for rejuvenation, which it is. But from what you just said, it sounds like it's a medical. Like you can use it to help in that field too.
Yeah. So there's a lot of benefit towards balancing all the tissues in the body, including the spine, the muscles, the fascial strains. But what we have now, which is really exciting, is these peptides, and platelet-rich plasma is also helpful. But one thing that people suffer from is they'll have injuries in a ligament or a tendon. Mm-hmm. So a lot of rotator cuff injuries, or I tore the tendon of my hamstring, and that can be something that takes over a year to heal on its own, and sometimes it never gets healed properly.
Right.
And what I found, especially this past year, using specific peptide injections into the areas, we can accelerate that healing process where people are feeling back to normal in 4 to 6 weeks sometimes.
Oh wow!
I have a woman now. I saw her. She started with the clinic in September, and one of her concerns is she had a hamstring tear, and she wants to run a marathon. It's gonna be her first marathon.
Is that how she tore it, running?
Yes.
Okay.
Yeah. So we did 2 sets of peptide injections, and she felt fantastic afterward. And I talked to her yesterday. She just did her 20-mile run, and she's doing fantastic, and she's going to do her marathon in December. So to give people those opportunities to heal things well, and this is using your body's natural things. Like peptides are natural.
I'm a fan of peptides as well. I used to take something called
Ipamorelin?
Yes, that one. Thank you. But now I heard they got banned.
Yeah, I think peptides have been around for a long time, and they've been mostly used for athletes and bodybuilders. And I think right now, as people are looking for more creative ways and going outside of the mainstream system, they started finding how effective these peptides are. But unfortunately, it just blew up. And now you have them all over Amazon. And the question is...
I didn't know you could buy... I thought you had to have a prescription to buy them.
Well, if you want to do it the right way, you do. But, all these companies are trying to monetize off of it. And it was just, going bananas. So the FDA just said, we got to shut this down and just kind of do some formal studies through our pharmaceutical companies before we can do it. And
Yeah.
I'm not sure how much of it is going to be big pharma that they're trying to cater towards or safety. I think there's an element of both.
Mm-hmm. My husband also took one as well. That was the Ibutamoren, and both of us. Like for me, the first one, like Ipamorelin, I felt amazing. And what I noticed is that because when women get older, we get boxy. It's like we start to lose like our what makes us a woman, like the curves and stuff, and you turn into it. It stopped that boxy feel, and so I was able to maintain like my hips and, like I said, things that make me a lady. And I loved it. And I was really, really sad when all that went down. So
yeah. So just to give a quick introduction about peptides to people who might not have heard about them or don't know what they are is, peptides are small chains of amino acids, and they're the chemical messengers of your body. So we have hormones that are based from cholesterol, and those are super important in regulating all of our body systems. Peptides are water-soluble, small chains of amino acids, like smaller than proteins would be. And what they do is they go to an area and they send a message. It's like putting out the bat signal.
Okay.
Please do this. And so when we look at, these GLP-1s people are using for weight loss, or even insulin is a peptide.
Is it really?
Mm-hmm.
Okay.
And so they're
people
extremely
use
effective.
insulin all the time.
Yeah. So peptides are extremely effective. They're in and out of the body pretty quickly, but what their effect is pretty profound. And so what they do is they send out this signal to recruit your immune system to do things, or to change the metabolism of the liver. Every peptide has a different role, and there's probably over 300,000 peptides. I think we know a lot about 3,600 of them.
Where does a peptide come from, though? You know how like you have protein and you have whey protein, then you have pea protein, or like vegetable protein. Where does a peptide come from? Is it produced in the lab, or?
Oh, okay. So, our bodies make peptides. So all of our organs are making different peptides, okay?
Mm-hmm.
And where are we getting the peptides that we're using in treatment? To do this correctly, what you want to do is you want to use specialized compounding pharmacies, okay, that have accreditations with the FDA that are super high level, okay?
Right.
And then that those compounding companies are using the same laboratories that are FDA approved for the pharmaceutical companies.
Okay.
So if you can do all that safely, then you have the safety of using these. So usually we're getting from compounding pharmacies. There is certain labs you could get them through, but traditionally it's compounding pharmacies, and they're made especially for each patient.
Right. Like I said, I wouldn't feel comfortable. It would have to be ordered from a doctor, as far as I'm concerned. I certainly wouldn't be ordering peptides off of Amazon. That's for sure.
Yeah, and I think with that, you just don't know where they're coming from. They could be overseas. What are the regulations, and what if something happens? God forbid.
You start growing a third arm.
Yeah,
something weird starts happening to your skin. No, thank you.
So do everything right. Do it safe is the way to go.
Right. So your practice, that is like one section of your practice.
Yeah, and so I've had a lot of success with peptides. I've used them to augment and treat.
I love the story about the runner, though. That's fantastic.
Yeah, the runner's great. We've used it to treat autoimmune diseases when the traditional TNF-alpha inhibitors weren't working and they were suffering, and we would use, thymosin alpha, thymosin beta, BPC, and they would get tremendous amount of relief, and
like
so
being able to breathe.
Well, all their pain would go away, their energy would go up, So there's a lot of roles for peptides in different ways, and so it's very exciting because now we're, osteopathic medicine. One of the, theories of osteopathic medicine is we believe that the body has the ability to heal itself, and our job is to facilitate that.
Right.
And so using peptides, using hormones, these are things that are naturally found in our body. So if we can enhance our body's own messaging system to promote health and to heal, then that's a beautiful thing. And we're not using some foreign medicine that's been made to block a pathway. We're actually giving our body what it needs that it's been losing out on as we age.
Right. Well, when you see the pharmaceutical commercials, the amount of side effects is horrifying. This may cause, and then
a lot of it's cancer and lymphoma. Yeah.
The announcer talks for the next 30 seconds about all the side effects that could happen if you take this product. But the image is of a nice lady who looks like she's super happy because her skin isn't itchy anymore, or whatever it might be. So, but peptides and hormones and stuff like that, they don't have that kind of kickback, right? Like that kind of not withdrawal, but you know what I'm saying? The side effects.
Yeah, no, it's all natural. So as long as you're using it correctly and you're monitoring things correctly, then there's next to no risk.
That's beautiful. All right, on that note, we're going to go to break. And so stay tuned, everybody, because we have more BaaD Radio coming up. Well, welcome back. I want to give a huge thank you to our sponsor, Bolts Legal. Fear no storm with boltslegal.com and Balance Bodywork in Lake Mary. Derek Brantley is ready to take your pain away. Forge IT Consulting, providing a fully outsourced IT department with a personal touch for small business. Last but not least, I want to thank you to Ashley with Get Me Automated. Her and her team are ready to make your life easier through automation. So we're here with the owner of Osteopathic Health of Orlando. I'm going to get that right, but now the show is like on his last segment. And we're here with Dr. Shawn St. And so we've been talking about all the things that won't get you healthy. And the truth is you could probably have your own show and have endless content to talk about all the different things from, in this world of health and wellness. I do feel very passionate about all of it because my family has been personally affected by it, for the good. So, but you have a whole other slew of things that you offer in your practice. And so let's talk a little bit more about those.
Okay, great. So I would say the biggest thing that we offer at Osteopathic Health of Orlando is we're devoted to our patients. Mm-hmm. So we don't work for an insurance company. We work for you.
Okay, let's talk about that just for a minute though. So what that means is you don't have 12 minutes. You have an hour. You have whatever time you want, right?
Yeah, so insurance, you get about 5 to 10 minutes, and a lot of things are not approved or denied. And, for example, my dad needed back surgery, and I told him he needed an MRI. He lives in Massachusetts, and going through his insurance, he had to go to his PCP, then he had to do 6 months of physical therapy, which made things worse. And a year later, he finally got his MRI, and there was a cyst compressing the spinal cord and a nerve there. And then he finally got surgery. It feels great. So, But we could have done this in 1 month. You know what I'm saying?
Right.
So there's a lot of hindrances with insurance. It is very important, and people need it for catastrophes. But so I believe in working directly for the patients because it keeps me honest. And if I'm not doing a great job, then you're not coming back. Mm-hmm. So it keeps me, on my toes. So we offer that. So we take accountability for our patients. So I'm going to walk with you on your journey. I'm not going to give up. I'm not going to turf something to somebody else. I'm going to keep on trying to figure something out. And that's kind of what we specialize in is that devotion. But we offer primary care. Mm-hmm. We're great at, healing pain. So if you have a problem and you're debating, do I need surgery? This is the practice to come to.
I'm guessing that's primarily back pain?
Back pain, shoulder pain, knee pain. Do I need arthroscopic surgery on my shoulder? Can we fix this more naturally? Do I need neck surgery, or can we fix this in a different way? And I've helped a lot of people avoid surgery, and they're feeling great. And so we're probably the best place to go to if you're having pain and you're trying to decide, do I need surgery or not? Because if we can't fix it, then you probably need surgery.
Okay.
So that's another part. We do primary care. We do the hormone replacement. We do medical weight loss.
Oh, and we try to do medical weight loss. So that's why you knew what the name of that peptide was, huh?
Yeah, we do, and it's important for people, for their mental health and for their health. So, part of our approach is to, get them as healthy as possible. Supplements, vitamins. Do you have an injury that's inhibiting you from doing the exercise that you used to like to do, and that's why you've gained your weight? Well, maybe we can fix that injury. That way you can start to run again or go to the gym again. Right. That can be a part of your thing. And then we also use the peptides like tirzepatide, and there's many different things you can do to help enhance someone's weight loss, including doing a liver detox, making sure their gut health is optimal, making sure their diet's optimal, giving them the education that they need. So we kind of take over as a holistic approach to every person and individualized medicine for each person.
I would like to talk to you for a minute about gut health. That's something that I hear more and more about. Until I was 30, 40 years old, nobody ever said anything about gut health. Now it's all over the place. So what is all this about?
Sure. Well, we have, I think, 10 times more bacterial cells in our body than we do our own cells. So we live with these organisms. They're commensal organisms on our skin and our GI tract, but the GI tract is especially important. And, we think of somebody having an intestine and a colon, but it's not just this lining of this tube, What's surrounding, what's lined on the tube is this complex forest of different microbes and different proteins, amino acids, all these different things that are necessary for us to absorb nutrients, for us to have a healthy gut lining. And so part of what we eat, part of the bacteria that's in our gut really determines how healthy we are. So if you eat broccoli, it's not like your body absorbs broccoli. We need the microbes to digest that broccoli into smaller little pieces, and then that to be incorporated and absorbed through the bloodstream. And so a lot of people that have GI issues are having intolerances to food, or they're having imbalances in the types of bacteria. There's more harmful bacteria, or maybe some candidal overgrowth in the gut. And so it's really causing a lot of bloating and problems. And everyone's just trying to use these medications. But really what it comes down to is restoring that gut health. And there's tests we can do to check on all those things.
But I mean, it's all really based down to their diet?
It is.
So, I mean, what the problem is what they're eating.
I want to make an analogy. So, our body has an autonomic nervous system. It's our fight or flight or our regenerative nervous system. And it's called autonomic because we don't think about it. It just happens on its own. And so if a lion came charging into the room, our heart would start pumping and all the blood would go to our muscles and away from our GI tract, and we'd be able to fight or run. Now, when we are used to dealing with, and everyone talks about stress, right? So we get stress at work. We have relationships that are difficult. Sometimes we're caring for loved ones with chronic diseases. Right. Sometimes we have an angry boss that we have to deal with, but we need to keep our job. Unhealthy relationships. There's all these things that are happening, and people are stressed out and they're really having a hard time with things. Well, that environment is unhealthy, right? But we're also dealing with, if you think of the inside of your GI tract, it's also the outside world because we're putting all these things in, and our gut has to deal with what is acceptable to deal with and take into the body, and what do we have to fight off. And so the same dynamics of how stressful one's emotional and spiritual life can be with relationships and job and stress and children, all that, our gut's going through the same thing, and we're just not aware of it.
Right.
And so you end up getting a lot of issues with, either indigestion or inflammation throughout the body. So there's a lot of foods that people might not have an allergy to, but they have an immune response to.
Right. So what you put in, I mean, and it might be something that people say is healthy, like milk, and the truth is that for certain people, it might just be the worst thing they could do. Absolutely. Right. So gut health is super important. Now, I did see when I went to your office that one time, the room that you had with all of the rejuvenation. Let's talk about that for
Oh, sure. Minute. Yeah. So we invested in basically a lot of equipment that would give our patients the opportunity to do body sculpting and non-invasive aesthetics. And what I liked about it is all this equipment is FDA approved, so it's safe and it's proven to be effective. And what it's doing is it's harnessing your own body's response. So, for example, we have M-Sculpt Neo, and M-Sculpt Neo is really helpful for basically what it does is it uses two different technologies of energy, and one of them basically kills fat cells with heat. Okay. And the other one, while that's happening, does about 20,000 contractions that are super physiologic. So you gain all this muscle. So you get 25% more muscle gain, 30% fat loss, and it's all harnessing your own body's energies to do that. Well,
I think that is like that sort of stuff is a very nice complement to, you get somebody in, you get them feeling great, get them feel healthy, and then you've got these particular machines that can help them feel good on the outside. And so that's pretty cool. And it's non-injectables. So we're not talking about like Botox or any of that stuff.
Yeah, no Botox. Don't do Botox, everybody. We have something called M-Face that will tighten the muscles in your face that you need to be tightened. It will enhance your own fibroblasts to make collagen, elastin, hyaluronic acid, all the things you're looking for and you're putting on your face. You can just harness your own body to make those things by stimulating certain pathways. And so that's what I kind of like about it. And these machines can be used not just for aesthetics and to look good, but you could use, some of these machines for people who have had a stroke or have had Bell's palsy to get that, symmetry back or get that strength back. And so I'm personally trying to use them. I didn't think about that. Yeah, I'm personally trying to use them, beyond aesthetics, but to really help people. If somebody has a lot of low back pain, but they have fusions in their spine and they can't do sit-ups, well, we can tighten up their core by using this machine that can help relieve their back pain. So there's a lot of different ways if you think outside of the box that you could use these.
That's amazing. So we're actually coming towards the end of the show. So can you go ahead and give everybody all of your contact information?
Sure, yeah. So we are located in Baldwin Park, which is pretty close to downtown Orlando. The phone number is 407-506-4776. Our website is www.osteopathic.healthcare. And we are at 4625 Halder Lane.
All right. Thank you so much for being here. We'll have you on again. I want to give you a huge thank you to our sponsors, and thank you for tuning in. Have a great week, everyone. And remember to support local.